Okay, we're going over the side plank in this video, but it's a very specific way I want you to do the side plank because, again, this whole purpose is to rehab the back. A very common muscle that is injured in CrossFit is the QL muscle, or quadratus lumborum. I've injured it one too many times, and that's why I know and have this full sequence to rehab it back to health. And essentially, the QL muscle, in short, is a muscle right off to the side of your low back. It helps with side bending and extending the spine, as there's its two primary functions. And when we do the side plank, it's super important that we're targeting this muscle. So in other words, you should feel your low back working a little bit, but in a good way. And what I mean by this is, like, you by now most likely know what it means to have like muscular burn versus what it feels like to have like pain, right? In your muscles, like stabbing pain, dull pain, achiness, right? All those symptoms. If those symptoms pop up, any pinching sensations, then definitely stop and go inside the community, ask questions so we can make sure to cover our bases and make sure we're doing everything right. So how this works is side plank. First and foremost, we want to make sure that we are in a straight line. So when most people do side planks, they'll go like this, where they hold themselves like here, which is totally fine, right? But that targets a lot of the oblique. Again, the goal is the QL muscle, so we want to keep in one straight line. Number two is that we want to make sure when we are in the side plank here, how I frame this is basically all we're trying to do is, I'm going to lift my shirt up here because this will make more sense. We're trying to close the space off between my hip bone and my bottom of the rib cage as much as possible, right? So what we don't want is, I'm in this position here, lift my shirt up. If I'm kind of sagging my hips like this, right? In general, this is a good side plank cue, but it's really important in this one. If I'm sagging my hips like this, it's no go. It's going to put a lot of stretch on the QL muscle. What we want to do rather is close off that space. So I'm trying to relax my hips as much as possible. They're going to do work regardless, but what I want to imagine is if someone had a string, right, and they were pulling my hips upwards, I'd close off that space. And again, I'm making sure that my body is in one straight line, like I mentioned, so close off that space. Number three, cue number three, is making sure that with my elbow on the ground here, I'm not just trying to push to the ground, I'm also trying to pull down this way, like I'm crunching, right? So without doing this. Okay, so like I'm crunching, pull down, now I'm in this solid position, and you should start to feel that QL muscle. Regardless, you're gonna feel your obliques start working, but you should feel your low back start fatiguing, especially if it's irritated or has been irritated, then most likely you're gonna really start feeling it work, and that's good, right? That's what we want. It is super important that you don't go to failure on this. We're just trying to get some blood flow into it, get it to work like 70, 80-ish% on an effort level, and then call it from there, okay? So that is the side plank. That is how I want you to do the side plank. Get after it.